We're live. Oh, okay. I'm living. Welcome this evening. Today's when? 21st. 21st of May. Welcome again this evening for another get together. This is the new norm. People are getting together on computer, which is very weird for some of us. We don't know such things. But anyway, we have to learn. So welcome. Uh, I I usually introduce ourselves that we are coming from a platform called She Chooses to Live Initiative. It's a registered NGO that whose main work is to let people know, especially things to do with health, to make people be in a position to make their own choices, good choices to allow them to live. So She Chooses to Live has a slogan that says she chooses to live because she knows. And we want people to know. That's what makes us come here every Friday when we can and speak some topics that people have asked about or some things that are glaringly unknown. So we come to do just that, to try to let people know so that they're able to make informed choices in their health issues. So today we want to introduce my tech guy. To my left, she's called Marion Wakahe. She's actually the technical person. She opens this Facebook and tells me talk. She says, "We are live now." So that's what she does for me. And then I talk, and finally, when we finish, she removes us from here. So that's Marion Wakahe. She's a great tech guy. I'm Jane Wakahe, Dr. Jane Wakahe. I am an obstetrician gynecologist. A friend of mine keeps reminding me that I said obstetricians do not deliver babies, they obster. They stand in between women's legs and wait for babies to come. So yes, that's what I do. It's up to the woman to bring me the baby. Me, I just speak when it has been thrown out at me. So that is my job, and I'm also a gynecologist, which means dealing with women's issues and men's issues, reproductive issues. And then I've also done a bit of public health because I wanted to know Wajiko. I don't know if I've gotten to know Wajiko because I'm still talking to you, Princess Diana's, but I'm getting there. I'm getting to know Wajiko a bit more. So that's what we are, and that's why we are here talking. We like to be given topics to tackle. So if you have something that you'd want to be discussed, just let us know. We will find time to discuss it. Now, today we are, if I can have a bit of water, I keep telling you people water is very, very vital. So you must drink water. Whenever you see me sip, you sip yours. Anyway, um, the today we are discussing urinary incontinence or urine incontinence, and it's quite a good day to discuss that topic because this week we are dealing with trying to eradicate what is called obstetric fistula. Obstetric fistula means that when a woman was delivering, somehow there came a connection between either her bladder and the vagina or her bladder and the rectum. Most of the time, because of what is called obstructed labor, the baby's head gets stuck there. And because it's stuck for so long, then the area gets to lose blood supply and necrotizes, which means rots and makes a hole between the bladder and the bladder and the vagina, and sometimes between the bladder and the rectum, and I mean between the rectum and the vagina, so that a woman will pass feces through the vagina or pass urine through the vagina. It's it's a very undignified state. And it is totally preventable, those fistulae. So this week it's a question of trying to prevent and to eradicate the fistulae, obstetric fistulae in the country, which is quite a big problem. But today we are not talking that incontinence. The incontinence of fistula is actually continuous. There is no control. There is nothing until the fistula is actually mended. There is nothing one can do. They'll keep leaking urine, because as urine comes to the bladder, it just flows out through the vagina, because the vagina has no gate, no sphincter to hold the urine inside. So it's a very miserable state indeed, and women can get very undignified. I talked about the same thing when I talked about cancer of the cervix. When it is very advanced, it does the same thing like what a baby refusing to come out will do. It makes holes to the blood and to the urethra, and again one gets a fistula, but that is a cancer fistula. This is an obstetric fistula. And sometimes the obstetric fistula is possible to repair them, to surgically repair them, and give a woman some dignity. Otherwise, they are really shunned. So anyway, that's not the leakage, the incontinence we are talking about today. We are just talking about urine incontinence. And what does this mean? That the urine incontinence means that there is involuntary leakage of urine. One urinates without meaning to urinate, without intending to, and they are not wanting to urinate, but they find the urine has actually come out. And what is the reason? I've just touched a bit on the fistula, but that's a different reason. But here, the reasons we are going to discuss is either the sphincter of the sphincter. When I say sphincter, I mean gate. There is a gate that closes in the urine. Sometimes we can talk medical and it's not understandable. Anyway, a sphincter is a gate. It's something that tightens the outlet of the bladder and stops the urine just dribbling out. So in this case, when there is urine incontinence, then it means either that the sphincter has been, the strength of the sphincter has either gotten lost or it has gotten weakened. So the sphincter is no longer being functional, and somebody will pass urine without intending. Now, it's a very common problem actually, that urine incontinence is not very unusual, and it ranges in severity. Sometimes as little as one sneezes or coughs, and a bit of urine jets out. And other times there is so much inability to control that the urge comes and there is nothing one can do. They cannot even reach the toilet. They have already urinated on themselves, which is very sad indeed. Now, there are different types of urine incontinence, and it's important to know which one. It's important for the doctor to know which one, because then the treatment will be according to which one it is. But anyway, the types of incontinence, the most common one is called stress incontinence. And stress is just the word stress. It means that the bladder gets stressed either by a cough or by a sneeze, or by lifting something heavy, and that stresses the bladder, and then one tends to get a bit of jetting of urine. So that is stress incontinence. Then there is something called urge incontinence. This is an urge that comes so strong to urinate, you cannot hold. So that is called urge incontinence. It cannot let somebody hold it until they reach the toilet. Then there is another type called overflow incontinence. Overflow means that it's like a dam that is overflown. It is that one empties their urine from the bladder, but it doesn't completely empty for some reasons. And hence, even though one has emptied, they keep they keep dribbling a bit more. So that is called overflow incontinence. Then we have what is called functional incontinence. Now, in functional, this is that there is something that is the bladder could actually maybe hold, but there's something stopping you from getting to the toilet very quickly or opening buttons. For example, if somebody had arthritis, then they will not, the men will not be able to very quickly open buttons, and they'll find they have urinated on themselves. And the women may not be very quick enough to be able to remove their underwear. So that is functional. It's caused by something else, the functionality of the body. And then there is the mixed type. Mixed usually mixes the urge and the stress. So those two usually in some cases will go together, and that is called mixed incontinence. Now, what is the consequences of having this incontinence? It's a very, very sad situation indeed. You can imagine always smelling susu, not knowing when susu will come, and smelling adult susu, even child susu doesn't smell very nice. So the consequences is that this incontinence restricts the social activities that one would have. It negatively impacts one's quality of life, so that the self-esteem really goes down. You cannot be very proud if you're smelling funny. Not that you're supposed to be proud, but you should have enough strong self-esteem. It may also be an indication that there is a bigger problem underlying this, so it's something to be looked at. And then one of the other ones which nobody seems to talk about is that one can fall. If somebody is incontinent of urine and either is hurrying, they know they are going to pass urine before they reach the toilet, so they're in a hurry, they can fall. Or alternatively, they'll have dribbled urine, they'll have urinated on the floor, and they slide on the floor and they fall. So those are some of the consequences of this particular urine incontinence. Now, the urine incontinence can be temporary, so that it can be occasional, or it can be persistent, so that most of the time there is always a bit of urine. Now, we come to the causes of the incontinence. Like I said, we are not talking the surgical causes like the fistula. We are talking now causes that are more, shall I put it natural, although the word is not really natural, but more normal causes. So some of the causes of temporary incontinence, believe it or not, or no, you can believe this one because you have seen it, is alcohol. Alcohol is one of the greatest causes of temporary incontinence of urine. The other something is caffeine, drinking a lot of caffeine. A lot of caffeine does that. Drinking a lot of soft drinks which are carbonated. We are talking things like soda and the things that are carbonated drinks. Then people who are into what is called artificial sweeteners, those can actually cause stress, can cause temporary incontinence. They can cause somebody to get a bit of urine without intending to. The other one is chocolate, a lot of chocolate, a lot of spices, spices are good for immunity building, but there is a limit. If you go beyond a certain point and you're taking a lot of spices and a lot of chili, and even acidic foods, then one will find that they're getting to be a bit jetty. And the other one is excess sugar intake. That one, we even know it in diabetics, that they have to keep going to the toilet, and they can be incontinent. So those are things that you swallow through your mouth. Then the other thing is medicines. Some medicines will cause incontinence, urinary incontinence. Some of these are diuretics. Diuretics are things that are given to somebody to actually make them urinate more. say they are retaining water, or they are retaining water in their system, or their kidneys are not working very well, or their heart is not working very well, or sometimes high blood pressure. So some people get given what is called diuretics, and these ones will make somebody also have urine incontinence. There is also the medicine of sedation, sedatives, will also cause somebody to get incontinence. And this one will come as a surprise, but excessive intake of vitamin C. We tell you to take a lot of vitamin C to boost your immunity, but it's good to a certain point. If it is excess, vitamin C will actually cause you to get urine incontinence. So we've talked about foods, beverages, we've talked about medicines. Now, the other thing that can cause temporary incontinence is urinary tract infection. And the people who have had urinary tract infection know that they have to keep going, to keep running to the toilet, and sometimes it comes out before it is even there. So there is frequency, there is urgency, and there is also incontinence in urine infection. Then another one which we should take note of is actually constipation. Constipation will make somebody get incontinence in the sense that if the rectum, in the pelvis, there is the rectum, and then there is, in a woman, there is also the uterus, and in front there is the bladder. But if the rectum is very full, then what it will do, it will do two things. It will put pressure on the bladder, so that alone would make it incontinent. But not only will it put the pressure, it will also sit on the nerves, that some nerves that are shared between the rectum and the bladder. So that will cause urinary incontinence. So those are some of the causes, not exhaustive, but so those are some of the causes of temporary urinary incontinence, which can be quite easily dealt with. Then there is the more persistent urinary incontinence. The causes are a bit different, and the biggest cause of a bit permanent incontinence is actually pregnancy. Women who have carried pregnancies know that in the early stages of pregnancy, one of the signs of telling you that you are actually pregnant is the number of times you have to run to the toilet. And this is because the growing uterus is pressing on the bladder. And then later on, when the pregnancy is a bit bigger, there comes two things into play. There is the actual physical pressure of the baby's head or the baby's leg or the baby's bottom onto the bladder. But there is also the hormonal changes of pregnancy. In pregnancy, everything tends to go loose. So everything loosens up, and there can be quite a bit of urine incontinence in pregnancy, can be quite a bit disturbing. The other thing that causes persistent urine incontinence is childbirth. When a woman delivers a baby, then a few things happen. One, it weakens the pelvic floor of the woman when she is delivering the baby. Because she's pushing, the pelvic floor gets weakened. Sometimes some nerves get damaged in the pelvis, which makes it very easy to be incontinent. And sometimes not only is the push can be so much, especially if somebody has delivered many children. The push can be so much so that the bladder and the rectum are kind of falling out of the vagina, which makes it impossible for the urination to be done properly, because then the angulation is a bit different. So childbirth is one of the reasons why people get permanent urine incontinence. The other thing, and we pray that we get there, is age. Age alone is a reason to get urinary incontinence, both in men and in women. Age plays this part. And then what happens is that when one gets older, then the bladder, the muscles of the bladder becomes a bit weaker, and the bladder is not able to carry the full capacity of urine. So a little, and then it lets go. And the second thing about aging, which is very common as we grow older, this happens, is that there is what is called involuntary bladder contractions. The bladder just contracts on its own without it doesn't consult you. It just contracts on its own and lets out. And this is both male and female. And as we age, this becomes more frequent a problem. Now we come back to women. Women are not very lucky people. Well, women are very lucky people in many things. But where urine incontinence is concerned, they are not very lucky, because menopause is something else that causes women to get urine incontinence. And the reason for this is that the loss of the hormone called estrogen, that hormone that makes a woman into a lion, that hormone, once it is lost, not only does it literally degrade you, but it also causes the bladder to soften, to become looser, and the urethra to become looser, so that when one gets into my age, which is menopause, then it's very, very easy to just laugh, and you find urine going away out of your system. The other reason is that with menopause, then also the bladder, I mean, the pelvic floor becomes loose. The muscles, uh, when people are in my clinic, I show them my fingers and show them that when you become old, they wrinkle. So the muscles also of the pelvis do the same, they wrinkle and they get older. And for that reason, one can get urinary incontinence just because of age. Now, for men, they also get their turn, and men with prostate enlargement, whether it is benign or cancerous, will usually tend to get urine incontinence. They will usually tend to dribble urine, and sometimes even the treatment, when they have been treated for prostate cancer, even the treatment of the side effects of it can cause urine incontinence in men. The other thing that can cause kind of persistent incontinence is if there are some obstructions. For example, if there are things in the bladder, some stones, some things that are obstructing the flow of urine, then one tends to get a persistent urine incontinence. And we also have, if somebody has neurological disorder. Some neurological disorders are notorious for urine incontinence. For example, if somebody has what is called multiple sclerosis, they are likely to get urine incontinence. If somebody is suffering from Parkinson's, they are likely also to be having urinary incontinence. If somebody gets stroke, they suffer urine incontinence at the same time. If somebody has got a brain tumor, because all these things, including bladder, everything is controlled from the brain at some point. And if somebody has a brain swelling or a brain tumor, they could get incontinence. And of course, people who have had spinal cord injuries, like the people who have accidents and they have to be like on wheelchair, then those people will be having persistent urine incontinence. So those are the few causes of persistent urinary incontinence, and it is it's a very sad state indeed. Now, what are the risk factors of getting urinary incontinence? And the number one risk factor is being a woman. Just being a woman makes you many, many, many times more likely to get urine incontinence than a man. Like we talked about it, both because of the childbirth, the pregnancy, the menopause, and also the anatomical structure of the woman's bladder urethra. That makes it much, much easier for a woman to get incontinence. So yes, risk factor is being a woman. The other one is, I don't call this a risk factor. Even being a woman, I don't call it a risk factor. But if you're a woman, you're more likely. And if you are, the other one is age. Age is more likely, like I explained earlier. And the other one is overweight. People who are obese will tend to get incontinence because the 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 weight will affect the nerves of the bladder, the nerves supplying the area of the bladder, and that will is a risk factor. The other risk factor is something like diabetes. Diabetes will cause people to have incontinence. Uh, like I said, neurological disorders like Parkinson's, and then there are some families. There are actually some families. There is family history. If you are no cousin is far. If your sister is incontinent, you're likely to also become incontinent. So there's a familial something there which is not quite understood. Now the complications of incontinence are not that nice. One of them is that the skin, because of always being with urine, will get what is called excoriation. It will be a sick skin, and sometimes you need quite a bit of ointment and some things to help it along. Then the other thing is that there will be more frequent urinary tract infection. This is more common actually, not with the just stress with the incontinence, urinary incontinence, but with fistula, because then there is always a connection between the urine and and the system and some bacteria. So urinary tract infection is more common in people who are having urinary tract urinary urinary tract infection is more common in people who are having urine incontinence. Now there is also, of course, the one of the other complication is self-esteem and loss of self-esteem indeed. Now, today I'll break one of my rules and talk about a bit of treatment. Like I usually say, I don't talk treatment here. And even now, I'll not talk deep treatment, but there are some things that we need to talk about. And how would we prevent ourselves from getting urinary incontinence? And one of actually a few things. I mean, normal things like lose weight, because that will weight maintenance will stop the bladder being pressed on. Avoid things like alcohol and caffeine. Avoid constipation. Uh, uh, and the one that I'm going to talk about it later, but I'm going to mention it here because it serves as a prevention and as a treatment. And that is pelvic floor exercises, both for men and for women. And these go by the name of Kegels. Those of you who have been to my clinic know I love talking about Kegels because it's very, very vital indeed. So it's one of the other way of preventing. Now, let's assume you have urine incontinence. What do? You please go to your doctor because there is no point always smelling badly at people, and maybe it's something that can very, very easily be fixed. So what will the doctor do? The doctor will take a very detailed history. They'll ask you many things to try to decide what the root cause of the incontinence is. Then they'll usually do a physical examination. For the woman, they'll check around where the urethra and the bladder is, that is around the vaginal area, and they'll usually tell you to cough. And believe you me, when we tell you to cough, our faces are very far because they could jack some urine. So they will tell you to cough or to sneeze or something. For men, they will usually examine to feel whether the prostate is enlarged or not. Then after taking the history and doing a physical, usually one will be sent to get a urine sample. to check that whether it is an infection that is actually causing the incontinence. If it's an infection, then it will of course be treated. Then another checkup that can be done is a pelvic ultrasound. This one will tell us how much urine, when you have a bladder full of urine, and then you are scanned, and then you go past urine and you're scanned again. That will tell us whether you actually empty your bladder completely, or it has what is called overflow incontinence, whether some keeps some urine gets left behind, that you're not able to void all of the urine. Then usually you'll be asked to keep a diary of what you drank for about a week, a diary of what you drank, with how much sugar, was it carbonated, blah, 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 what you drank, and how much urine you passed, and whether you had the urge or whether you had any stress incontinence. So that is all part of the history. Now, when it comes to now treatment, the doctor will decide what kind of incontinence one is having, and then they'll manage according to what it is that is the root cause. But some simple, like I said today, I'll break my rule and give some simple answers to some things that you can do at home, simple home solutions that you can do other than avoiding alcohol, avoiding caffeine, and those things. So one of the simple things one can do at home is actually bladder train. One can train their bladder. When you feel an urge to pass urine, you tell your brain, this of course you have to do at home, where it is possible to, if the bladder lets go, where it is possible to change. But anyway, where you're in a comfortable place, you train your bladder. You feel the urge to urinate, but you tell yourself to hold that urine. And you hold for maybe 10 minutes. And each time you do that, you keep holding for a bit longer, so that you can train your bladder to hold urine much, much longer. That is one of the home remedies. So it delays the urge to, the time to pass, so that you can hold it a bit longer. That will train the bladder. The other one is what is called to double void. That is when you pass urine, a few minutes later pass again, just in case you had left some. And this is quite a common habit with women. I deal a lot with women, so I hear a lot. They'll tell you they passed urine, and then they woke up and another lot came out. Instead of waking up, just pass, wait a bit, and then pass again, and that will clear the bladder, and especially the older women. Pass and then pass again. Then the other thing is that as we grow older, we become we revert to childhood. So we should schedule our time for urination. It is a home remedy. You can tell yourself you'll pass urine at such and such a time, at such and such a time, and try to keep that schedule going. Then the other thing is to increase fiber intake. This is in an effort to stop oneself from getting constipated and pressing the bladder with the fecal material that would make one pass urine without intention when the rectum is totally full. So you're passing one side without intention and not being able to pass the other side. And the other home remedy is to drop weight. Now, I want to spend a bit of time on the main remedy that I think will help many people, and that is pelvic floor exercises. Now, both men and women need pelvic floor exercises. The pelvic floor is like a canvas that holds the pelvic organs up. instead of letting them drop out, it holds them up. And that muscle needs to be strengthened. And if it is strengthened, there are many, many benefits. The strengthening of that muscle is called Kegel's exercise. I'll start with the men because theirs is a bit simpler than the women, and they also need it. A man, that particular muscle is very unique in the sense that when you sit up, you don't strengthen the pelvic floor. When you do leg ups, you don't strengthen the pelvic floor. When you jog, you don't strengthen the pelvic floor. It has to be strengthened on its own, and you have to understand which muscle it is that you're strengthening in order to be able to strengthen it. So for men, the way to go about it is to either stand still and try to pretend to hold urine. When you do that, if you are doing it with a proper muscle, then you will feel a tightening in the anus, in the rectum, and the penis will lift up a little bit. But most of the time, it takes time to get to know that muscle because you'll find a lot of people trying to tighten pelvic muscles with their abdomen. So if you're trying to do the pelvic muscle and you feel your abdomen tighten, then you are doing wrong. If you are doing and you feel your chest tighten, you are doing by the wrong one. And if you are doing it and you feel your buttocks tighten, you're doing the wrong one. So maybe the way to go around it is to do it the way women do. And this is what you women do. You will go to the toilet. This is trying to isolate what it is, that muscle that you tighten. So when you have urine, you go to the toilet. You remove your panty completely. This is for women who sit on toilets. But like I said, I keep talking to Princess Diana's here, so I know you all have sit on toilets, because sit on toilets, it will take a bit of time and it can be quite tiresome. So you go to the toilet, you remove your panty completely, and you put your legs wide apart, and you susu, you kojoa kidogo, you susu a bit, and then you hold. And when you hold and count up to 10 seconds. You hold for about 10 seconds, and then you let go again. And when letting go, you let go very gently. When holding, you hold a bit faster. And then you count another 10 seconds. So each time for about three times of urination, you hold 10 holdings in one urination, and you do about 3 times in a day, so that this one is geared towards isolating what muscle it is that you are needing to tighten. And then when you have isolated, it takes about a week for you to know exactly which muscle it is that you tighten, so that you're not jacking your buttocks and you're not pulling in your tummy to try to tighten the pelvic floor. Once you have known what that muscle is, then there is you keep a certain schedule, and you keep doing it properly. You keep doing it. Other times when you're not in the toilet, you can be cooking, you can be talking to somebody, and you keep doing it. That pelvic floor exercises. I'll both men and women need to do it. That pelvic floor exercises. It's got a lot of benefits indeed. For the women, today the biggest benefit we are talking about is that it helps to hold urine, so that even when you are age 90, you'll be able to have your bladder full and cough, and it will not embarrass you. You'll also find that women who haven't done pelvic floor exercises, they they will be sitting very nicely, and when they stand up, their vagina says, it makes sound that is not very pleasant in the public. So that will be eliminated. It will be possible to hold gas, the flatus, the farting from behind. It will be possible to hold. For women, There's a lot of benefits to it indeed. Not to mention that even sexually, it makes sex a bit very much sweeter than usual. For the men, the holding the pelvic floor exercises has also a few advantages. It has the advantage that it can help somebody hold their urine, but also for people like who have erectile problems, who have problems getting an erection, the pelvic floor strengthening will help. It helps quite a bit. The people who have what is called premature ejaculation, it helps quite a bit. It's been shown to help. So men and women do those exercises. They are very useful, even in daily life, not just preventing yourself from smelling like a urinal, which is not a very good thing. Now, there are times when all these measures will fail, including the pelvic floor exercises. There are times when these measures will fail, and those times the doctor will decide whether to give you some medicines. There are sometimes medicines to stop the irritability of the bladder that would make it easier to urinate. There are also other medicines, and there is a time that you will be told that it has to be surgical. So those deep treatments, I'll leave to you and your doctor in case you have to get there. But before you get there, try those others that I've talked about, and try to stop yourself from smelling badly, and then from being unable to go visiting your visiting laws because you might embarrass yourself. So that is urinary incontinence, causes, some home remedies. I believe I've talked a lot. I'll stop there. And then I'll get any questions that we have. Like I keep saying, we need to get to Wajiko. Yeah, somehow we shall get to Wajiko. I don't know how, but somehow we shall get to Wajiko. So now I'll call the tech guy to come and check whether we have any questions, and then we can answer them. Like I said, I'm not tech. Me, I just talk. That is bad English. I get told so by my grandsons. If I say me, that's bad. I'm told to show that's wrong English. So sorry for the wrong English. But me, I just talk. So are there questions? No questions? No comments?
Only one hello.
Oh, hello. Okay, that is good. I'm going to assume everybody understood. I'm going to assume everybody will do Kegels exercises. And I'm going to assume that when you get to my age, you will laugh and you will not susu on yourself because I've taught you how to not susu on yourself. So we say good night. We say good night. You can send us some other topics that you want covered. We shall try to cover them as much as we can. That's what She Chooses to Live initiative is all about. It's trying to give people knowledge, to choose a good life, to choose self-esteem, because yeah. And the people with the fistula, the obstetric fistula, we wish you the very, very best. We hope the kind of smile that comes on a woman who has been repaired a fistula, it's worth seeing. So we hope that it's doable for all of you. Okay, so good night.
Good night. Just this is Pat Mwendwa. Thank you, Daktari, for a very informative session. I am surprised about vitamin C.
Excessive of it does.
Okay. I think that's all.
That's it. Good night.
Good night.
We'll see you soon again. Keep safe.